This is an audio test from the room for the Zoom. Testing 1, 2, 3, 4, 5. Yes, Simeon, what's up? No, I don't know, but I don't know what.
Hey guys, you should be able to hear us.
Dr. Kluge, this is Chris in Geneva. If we could just do a very quick audio test for you, please, sir.
Hello, this is Copenhagen. Can you hear us?
We can hear you, Copenhagen, very well. Thank you so much. Please stand by. This is another audio test from Geneva.
This is an audio test for Hindi interpreters. Can you hear me?
This is another audio test for our live stream. Testing 1, 2, 3. Testing 1, 2, 3. This is yet another audio test for the Zoom. Testing 1, 2, 3. Do you hear us on the live stream?
We're just doing a quick audio test. Please, can the French booth speak a little bit? Thanks. Is that all right?
Hello everybody, this is Margareta Harris in Geneva welcoming you to the WHO Global Press Conference. Today is a historical event, the launch of our WHO Global Air Quality Guidelines. And I'd like to emphasize that because this press conference has this very special focus, we will prioritize questions about the guidelines. So do please indicate your question so we can ensure it gets answered. We will have 3 speakers, followed by an expert panel. Speaking today will be, as always, our WHO Director General, Dr. Tedros Adhanom Ghebreyesus. He will be followed by Dr. Hans Kluge, the WHO Regional Director for Europe. And joining Dr. Kluge online will be Dr. Michał Krzyżanowski, who is the co-chair of the Guideline Development Group responsible for reviewing the evidence and developing this new guidance. After the 3 speakers, I will open the floor to questions by the expert panel, and this includes the speakers and Dr. María Neira, WHO Director for Environment, Climate Change and Health, and also in Euro, Dr. Dorota Jarosińska. So, without further ado, I will hand the floor to Dr. Tedros for his opening remarks. Dr. Tedros, you have the floor.
Thank you, Margareta. Good morning, good afternoon, and good evening. This morning I returned to Geneva from my trip to Lebanon and Afghanistan. Tomorrow we will hold a dedicated press conference with Dr. Ahmed Al-Mandari, the Regional Director of the WHO Eastern Mediterranean region, to talk about the health crisis in Lebanon and Afghanistan and the urgent needs of those two countries. Today, our focus is on air pollution. There is nothing more essential for life than air. And yet, because of air pollution, the simple act of breathing contributes to 7 million deaths a year. Almost everyone around the world is exposed to unhealthy levels of air pollution. Inhaling dirty air increases the risk of respiratory diseases like pneumonia, asthma, and chronic obstructive pulmonary disease, and increases the risk of severe COVID-19. It's also a major cause of other non-communicable diseases like ischemic heart disease, stroke, and cancers. Air pollution is a health threat in all countries, but especially for vulnerable groups in low and middle-income countries with poor air quality due to urbanization and rapid economic development, and air pollution in the home caused by cooking, heating, and lighting. Today, we're proud to launch the updated WHO Global Air Quality Guidelines, which provide clear evidence of the damage air pollution inflicts on human health. Since the last update in 2005, a substantial new body of evidence has accumulated, further demonstrating the degree to which air pollution affects all parts of the body, from the brain to a growing baby in a mother's womb, at even lower concentrations than previously observed. That's why these new guidelines include low recommended levels for pollutants, including particulate matter, nitrogen dioxide, sulfur dioxide, and ozone. These new guidelines will have major implications for public health. They provide a practical tool for improving air quality around the world and a robust evidence base for developing national and local air quality standards. They can also help to inform and strengthen policies in sectors including energy, waste management, agriculture, and transport. For countries with high levels of air pollution, the guidelines provide interim targets that can be used as milestones on the path to achieving the recommended air quality levels. WHO is dedicated to supporting countries in their fight against air pollution, to building the capacity and knowledge of health workers to advocate for clean air, and to strengthening the ability of the health sector to work with other sectors to tackle sources of air pollution. This is not a job for the health sector alone. It requires an all-of-government and all-of-society approach to improve the governance of air quality, the monitoring of air pollution risks, and the engagement of all economic sectors in reducing emissions. I urge all countries to put these guidelines to use, to save lives, support healthy communities, and help address the climate crisis. These guidelines come at an important time, ahead of the COP26 climate change conference in November. They are the result of a close collaboration between WHO headquarters and our European regional office. I'm now pleased to introduce Dr. Hans Kluge, our Regional Director for Europe, to say more about the new guidelines and their implications for Europe and the world. Hans, you have the floor.
Thank you so much, Dr. Tedros. Ladies and gentlemen, as our WHO Director General was mentioning, every single year, exposure to both ambient and indoor air pollution is estimated to to cause more than 7 million deaths globally and millions more of healthy years of life lost. This burden of disease is large and it is growing and makes air pollution the single most important environmental risk factor for our health. It is one of the leading risk factors for non-communicable diseases, which continue to increase worldwide as a result of aging populations and changes in lifestyle. Everybody on the planet has the fundamental right to breathe clean air. Like most environmental factors, air pollution does not respect national boundaries. The nature of this challenge calls for an enhanced and immediate action because clean air is a political choice and a societal responsibility. Today, we launched the new WHO Global Air Quality Guidelines, a key step in that global response. Based on the systematic review of accumulated evidence, they provide recommendations on air quality guideline levels to protect public health for 6 key air pollutants. These guidelines serve as an up-to-date reference for policies and actions to assess the health impact of air pollution on populations for the benefit of better health across the world, especially for vulnerable populations. The last time WHO published air quality guidelines was in 2006. In the 15 years since, there has been a substantial increase in evidence of how and to what degree air pollution affects different aspects of human health. For that reason, and after a thorough systematic review of this accumulated evidence, almost all the updated guidelines levels are now lower than they were 15 years ago. We know that for many countries, this places the bar even higher than before. However, these guidelines also provide interim targets to support a stepwise progress towards their achievement, and thus a gradual yet measurable public health benefit. The next step is now for policymakers around the world to use these guidelines to develop evidence-informed policies to decrease the unacceptable health burden that results from air pollution exposure. The urgent actions that are needed require sustained political commitment and cooperation of various sectors and stakeholders. And there are 2 pieces of good news here. The first is that almost all efforts to improve air quality can enhance climate action. And almost all climate change mitigation efforts can in turn improve air quality with immediate health benefits. This multiplies the return of investments into measures that simultaneously address both challenges while improving health. The second is that with the important resources being mobilized around the world to recover from the COVID-19 crisis, we have a unique window of opportunity to build forward better towards a healthy and green recovery. In this context, the guidelines provide a robust health argument that goes hand in hand with the global fight against climate change and environmental pollution. We are extremely grateful to all the scientists, all the colleagues, and all partners around the world who have contributed time and resources to produce these guidelines. I am immensely proud that their development has been overseen by a steering group hosted by our WHO European Centre for Environment and Health in Germany, continuing the long tradition that the Centre has provided to coordinating this important normative work of the WHO since the mid-1980s. Dr. Dorota Jarosińska, who coordinated this work and efforts, joins us today from our office in Bonn to answer your questions. A big thank you to you and your team, Dorota. Together, we can improve air quality while protecting and improving our health and the health of the generations to come. I now leave you in the very capable hands of the experts behind this landmark document to answer your questions. Thank you.
Thank you so much, Hans, and thank you to all our colleagues in the European Regional Office for their work on this report. And Margaret, back to you.
Thank you very much, Dr. Tedros and Dr. Kluge. So now we will be opening it to the question and answer session. And as I said, this is really focusing on the air pollution questions. As I mentioned before, we have Dr. María Neira in the room here in WHO, and we have Dr. Michał Krzyżanowski, who is co-chair of the Guideline Development Group, who reviewed the evidence and made the recommendations in this guidance. We also have Dr. Dorota, pardon me, I've just lost my place, Dorota Jarosińska in the Euro. So from now I will open the questions, and the first in line is Robin Millard from AFP. Robin, please unmute yourself and ask your question.
Thank you. As was mentioned, the air quality guidelines have been issued just a few weeks before the COP26 summit. In light of the new guidelines, what sort of action should leaders be taking at COP26 to combat air pollution? And secondly, if I may sneak it in, Dr. Tedros, can you confirm that you're running for a second term as Director General of the WHO? Thank you.
So, no, we are referring all questions to the website about the election. There's a good, frequently asked questions, a lot of information there. So please access and use the information that's very available. Thank you. And now I'll hand over to Dr. María Neira for your first question.
Thank you very much for this very relevant question about how this linked to the COP26. WHO is preparing a very big report to be presented at the COP26 to strengthen the importance of having more action on mitigating the causes of climate change, because those mitigation interventions will have enormous health benefits. And most of the health benefits of mitigating the causes of climate change will come in the sense that they will reduce the levels of air pollution, and by doing so, you can imagine the incredible number of lives we will save. So we used to say in WHO that the Paris Treaty is as well a health treaty, a public health treaty, because if you implement properly the Paris Treaty, in fact, you are implementing a very good public health agenda, because most of the actions you need to take are about reducing the combustion of fossil fuels, for instance, and this will result in incredible reduction on the levels of air pollution and the benefits of the health of the people. Over. So the report we are presenting at COP will be launched here on the 7th of October, and it is called The Health Argument for Climate Action. So I think it gives you an idea how much we will stress the health co-benefits of tackling the causes of climate change. Thank you.
Thank you very much, Dr. Neira. I'm just checking with Euro if they wish to come in. I don't see. Okay, we'll go to the next question. Gabriella from Processo, please unmute yourself and ask your question.
Hi, hello. Thank you for giving me the floor. Hey, Dr. Tedros, don't leave. Okay, so according to WHO reports, with the current guidelines, several cities in Mexico were below the acceptable level for the WHO. So now, with this update, what is the scenario for the population of countries like Mexico? And what is the call of your office for states who insist on continuing to use oil as the main driver of their economies? Thank you.
I think we'll start with Dr. Neira and see if our Euro colleagues would like to join as well.
Thank you very much for your question. Clearly, if we want to reduce the levels of air pollution globally, one of the key questions is related to the energy sector. So we need to, as the call by launching today this updated air quality guideline is very much about accelerating this healthy energy transition that is very much needed, moving to renewable and clean sources of energy, because this will have a very positive impact on reducing the greenhouse gases emissions and therefore tackling the causes of climate change and reducing air pollution. And both are critical pillars of our health. So clearly the energy transition and influencing how quick and how ambitiously countries will do this transition to clean sources of energy is fundamental for our health, and is clearly an argument. We are providing all sorts of arguments regarding how much stopping the use of combustion of fossil fuels will benefit the health of the people. There are plenty of scientific evidence and even economic arguments, and it's part of the manifesto that WHO did on healthy and green recovery after COVID-19, where we insisted that one of the key prescriptions will be a healthy energy transition, as will determine very much our health. Regarding most polluted cities around the world, which are already kind of challenged by reducing the level of air pollution, they need to be more proactive on this type of measures. The call today of this new guideline is for more urgent action on tackling the causes of air pollution, because we want to save lives and we have now much more evidence. But if reaching those targets that we are proposing today, those levels, will be very difficult, what is new as well in these guidelines is that we are proposing interim targets that might be a way to move on very strong steps for those countries where the pollution levels are very high and they need to progressively. But the call is for urgent action, and I think linked to the COP26 makes even more strong arguments for that. Over.
Thank you, Dr. Neira. I'm just checking whether we have comments from our experts online from Bonn. No?
Hi.
Yes?
Dorota speaking.
Please go ahead, Dorota.
I just would like to reiterate this fact that these new guidelines, the levels are lower for several pollutants, which is based on the systematic review of the evidence showing that these health effects occur also at exposure levels lower than we thought before. So this is really to strengthen and to reinforce this health argument for action, even if it is to start from achieving these consecutive interim targets, so also in the very, very polluted areas. Thank you.
Thank you very much for that. I'd like to remind journalists to please put your media outlet under your name so that we know, because everybody, we've got a huge number of people online, and some people are not necessarily journalists. I understand you've got questions, but this is a press conference, so we are only taking questions from journalists today. Now, the next journalist with a question is Maria Marabato from Helio. Maria, please unmute yourself and go ahead.
Thank you. My question is, I was wondering if you could explain why the level for sulfur dioxide has increased from 20 to 40 micrograms per cubic meter.
I will be happy to answer, Margaret, but maybe Michał Krzyżanowski or Dorota want to join in.
Yes, good afternoon. I will be glad to answer this question. There are two reasons for higher guideline values. One is vast new evidence which was produced in the last 15 years, which confirms what we knew before about sulfur dioxide exposure, that it is producing health effects up to the very low levels. The second argument for changing the guideline value was the methodology of setting the guideline, which was different than back in 2005. We tried to make the guidelines comparable between various pollutants, and using the same methodology, the same protocol of defining the guideline values. And this protocol ended up actually with a higher value than before. This value is believed to cut the health effects to the same extent as guidelines for other pollutants. So we believe that it is fair to have it in this form as it is now. Thank you.
Margaret, just to clarify for those who are listening, that the SO2 is the only guidelines value that is increasing. The rest of the 6 pollutants, I mean 5 pollutants, the levels are going are lower in order to protect health. So maybe for those who didn't have time to see the table, you will clearly understand that for most of the pollutants, we are recommending now lower levels. Over.
Thank you very much, Dr. Neira. So the next question goes to Lisa Schlein from Voice of America. Lisa, please unmute yourself and ask your question.
Yes, hello. Hi, Margaret. Thank you. Yeah, I'll put my question in a very simplistic way because I'm very simplistic about this issue. In terms of the reductions of particulate matter and other pollutants, are you actually emphasizing green technologies as a way to reduce air pollution? And I'm wondering whether there are specific measures that individuals can take to protect themselves and keep themselves healthy, especially in the poorer countries. Thank you.
Thanks, Margaret. I'm happy to start, but I'm sure that my colleagues in Europe will like to add on that. What WHO will be tackling air pollution requires a very holistic approach. So first you need to do an assessment of what are the sources of pollution on your specific environment, and then obviously you need to set up interventions to address those, to reduce those sources of pollution. Essentially, as you well know, Lisa, is the energy sector, it will be the transport sector, it will be the agriculture, the industrial, waste management, and the use of, at the household level for fuels for heating and lighting. Essentially, those are the most important ones. So it will require a holistic approach. Most of the time, it will require legislation. It will require a political willingness to do it. It will require a very big investment. As an individual, the best we can do will be first to be aware of how air pollution is affecting your health, how bad this is, because if you are aware, you can then put the political pressure on those who have the capacity to take decisions. So, and then as an individual, of course, you can lead by example. If instead of using your private car every day, you will consider using a good public transport system, if there is available, or you recycle, or you are very efficient on the way you use your energy, or you create a group and you pass the information to others, or you don't drop your child at the entrance of the school and you keep the engine, still operating. I think the children needs to be protected very much today. And by the way, there is a very nice initiative that will be launched today, collecting examples of fathers and mothers of obviously families talking about having a child with asthma, having a child suffering from exposure to air pollution, that I think those individual and very human pieces of reality should be considered as well. But Margaret, over to you. Maybe I'm sure that Europe might want to contribute as well.
Yes, thank you very much. Yes, Maria has outlined a range of activities and interventions to be implemented. I would like only to add that the very guideline document has focused on the review of the evidence to generate these air quality guideline levels. It was beyond the scope to look into interventions into specific sectors, However, we are confident that these new values, revised values, in most cases lower values, will reinforce all the efforts in different sectors, including those described a while ago by Maria. Thank you.
Thank you very much for all those comprehensive answers. The next question goes to Jamie Keating from Associated Press. Jamie, please unmute yourself and go ahead, ask your question. Jamie, are you there? We're not hearing you.
Crap, I'm still having a microphone problem.
No, we can hear you now.
We can hear you now, Jamie. Would you like to hold your question? We'll go to the next one.
No, I have my question if you can hear me. Sorry about that.
Go ahead.
I hope you didn't hear my expletives as I was not able to get the microphone working. Was wondering, thank you, this is for Dr. Neira, I believe. I noticed that in the executive summary that your call is mainly addressed to three groups. It's addressed to governments, to NGOs, and academia, if I can sort of summarize those quite quickly. But I'm wondering what your recommendations might be for the broader public. I mean, what the recommendation might be for anyone, such as people in wealthy countries who drive big gas-guzzling cars, to people in poor countries who need to use heating oil or cooking oil to simply to survive. What is your message to individual people around the world? And I'd love to slip in another with Dr. Kluge if he's still there.
Should I start?
Yes, Dr. Neira will start, and then Dr. Kluge will answer as well if he wishes to join.
Thank you. I fully agree with you. I mean, I don't know where we said that only three sectors, but in fact, those recommendations and these guidelines are for everyone, the three groups that you have described, but this will go as well to the health sector, the public health professionals at large. It goes to any citizens. It goes to activists. They need to go everywhere, because an economic sector, because there are many decisions that need to be taken by policymakers, but as well the private sector, the economic sector, they need to contribute. What I would recommend to the broad, I mean, to the citizens, as I say, definitely we can change our lifestyle on a positive way. And this change on the lifestyle will have plenty of benefits, not only for reducing air pollution, but for a more sustainable life and creating healthy life conditions. Examples, energy efficiency at home. Make sure that you have a system that you use the heating and the cooling system on a very efficient way. That will help you reduce contributing to air pollution, but at the same time, it will reduce the economic cost, and definitely. If you can share your carpooling, or if you can take public transport, or you can bike, or you can walk, or you can create a group where you put pressure on your mayor, the mayor of your city, if you live on a city, and then make sure that there are measures that will contribute. Of course, you need to be a champion as well on recycling. You need to be a champion on not using plastic that will end up, incinerated somewhere. You need to be a champion as well on a healthy diet, because that will as well part of the manufacturing and the way we contribute to all of this pollution. So there are many actions, and you can do it as an individual or on an association. There are plenty of associations. One of my favorites is Moms for Clean Air, because there are mothers and grandmothers and fathers as well, of course, that because they are very much aware on how air pollution is affecting or aggravating, for instance, asthma of their children, they are really very active and they are mobilizing. So you can do it through associations or individuals, be aware of the levels of air pollution in your city, and make sure as well that you will create the necessary awareness and actions to do that.
Thank you, Dr. Neira. Over to Euro, if there's anything to add.
Thank you very much, and thank you, Dr. María Neira and Jamie. Very good to hear about you in a different forum. So it is everyone's responsibility, but we must make the healthy choice the easy choice, which is the basic principle of public health. So everyone has to do its share, and we have to involve a lot the youth. That's why a week ago, we had the first meeting of the WHO European Young People and Young Professionals Forum, because they are the ones, like my daughters, who are putting me the responsibility what to do. But at the same time, we should not put all the responsibility on the people neither. As governments, as policymakers, there is a responsibility to create what we call the enabling environment. So it goes both ways. Thank you.
Thank you very much, Dr. Kluge. The next question goes to Antonio of FA. Antonio, please unmute yourself and ask your question.
Hello, good afternoon. I have two questions, but very quick ones. First one is, how many million deaths can be prevented if the countries respect these guidelines? How many of these 7 million deaths can be avoided? And second question is, does this new guideline mean that these pollutants are more dangerous for human health than we thought 15 years ago? Thank you very much.
Thank you. Dr. Neira will begin, and I expect that our experts in Euro might want to add something.
And with the permission of everyone, I will speak in Spanish because this is a multilingual environment, so please feel free to ask questions on different languages if you want. Antonio, gracias por la pregunta. Estoy totalmente de acuerdo que es una pregunta muy importante. ¿Cuántas vidas podemos salvar? Una respuesta muy concreta. Si ejecutamos los niveles recomendados por estas nuevas líneas guía y bajamos esos niveles sobre todo el del PM, del PM 2.5, y ajustamos a lo que recomendamos, se podrían salvar un 80% de esas vidas que hoy, desgraciadamente, estamos perdiendo. O sea que 80% de reducción en la mortalidad si llegáramos exactamente a esos niveles propuestos en estas líneas guías del OMS. Creo que vale la pena y cómo, ¿no? Y es un dato muy importante que vale la pena resaltar. Con respecto a si estos son más peligrosos, bueno, lo que hemos visto a través de los años y de la evidencia científica acumulada es que efectivamente el daño para la salud se produce a niveles incluso más bajos de exposición a esos contaminantes de lo que habíamos pensado hace 15 años atrás, de lo que la evidencia científica nos decía 15 años atrás. Y es por eso que ahora los hemos bajado de forma radical. O sea, son los mismos contaminantes, pero ahora sabemos que incluso a exposiciones a niveles más bajos resultan dañinos para la salud. I don't know whether Euro, Margaret.
Thank you. Would colleagues from Euro like to add anything to that very powerful statement?
Yes, well, I could echo what María Neira said about the lower levels and guidelines showing that we need to aim at lower levels of pollutants. And it's not because the pollutants became more dangerous. They used to be the same dangerous as now, 15 and 20 years ago. But we know much more, and we can identify, and we have observed actually in human populations effects at those low levels. So we have evidence which tell us where to go, and that's why WHO says we have to go in this direction to reduce the health effects. Indeed, 80% of current health impact should be eliminated. So with very cautious estimates, it would be more than 3 million deaths per year, which could be avoided if we get to those levels globally. Thank you.
Thank you very much for those answers. We're coming up to time, but we've got time for one more question from Stephanie Nebehay from Reuters. Stephanie, unmute yourself and ask your question.
Thanks very much, Margaret. I wondered if Dr. Neira or another panelist would perhaps expand a little bit on the significance of the reduction, the recommended reduction in the average annual exposure levels to significance of that, and how that will contribute to the debate on, on climate change and so forth. Thank you.
I will start, and I'm sure that Michał or Dorota might want to add. We started saying something that we say it many times already, which is that the estimated number of premature deaths caused by exposure to air pollution every year is 7 million. I mean, indoor and outdoor both combined. 7 million premature deaths caused by exposure to air pollution. We have been saying this terrible figure for a long time now, and I'm afraid the level of reaction and ambition on tackling the causes of air pollution is not at the level of the drama behind this terrible figure, because it's not just the deaths, it's as well the millions of healthy years of life that you are losing, and it's the economic impact that air pollution is having. According to the World Bank estimates, there are around $140 billion lost every year just because lost on working, on labor days, plus $3.5 trillion because of the cost, the health cost, the medical health cost associated with the diseases caused by exposure to air pollution. I think those two figures, plus effects on the agriculture production, effects on the infrastructure and the built environment and the degradation in general of the environment, this is very good to take it to the climate change agenda. And again, our argument is very, very strong. If you tackle the causes of climate change, you need to change the sources of pollution and the emissions and the gas emissions, and therefore, please move quickly to clean sources of energy, and then you will have a massive reduction. This massive reduction could be, if it's PM 2.5, which is the more damaging our health and causing more damage, if we reduce it and we align with the recommended, the new update, it will be saving, as we mentioned before, 80% of those premature deaths, plus the number of years of healthy lives that we are saving as well. I think this argument altogether is the one that we are taking to the COP26, to the climate change agenda, making sure that all the decisions they will take, the health argument will be very much present, and one of the strongest health arguments is about this air pollution, plus obviously healthy diets, more sustainable transport that will have other benefits. So it's so strong, these arguments, this health argument in all sense, health, economy, society, name it, that we think or we hope that this will, with your help as well, motivate and accelerate and increase the level of ambition and the urgency about this major public health issue. Over.
Thank you very much, Dr. Neira. Just checking with Euro, with Bonn, they'll come in now.
I would just add one word to this. It's inequities, because we are talking 7 million globally. We are talking about saving 80%. This is a huge potential, huge benefits. But under these global figures, we have huge inequities. So all these aspects that were mentioned a minute ago, they are affecting different groups of people in a different way, putting those already more vulnerable and disadvantaged even farther from the expected health condition that we would like to see everyone. Thank you.
Thank you very much. So now we'll... Oh. Sorry, there is another intervention.
If I may, a short addition, there's Michał. Yeah, it is important to stress that air quality guidelines contain not only the air quality guideline levels, which are the ultimate objective of all clean air policies, but also those interim targets. So they give some milestones for reduction of pollution in various environments, in various places, also those which are currently very badly polluted, and well, we cannot expect that they will reach air quality guidelines level very soon. But the point of those guidelines is that pollution reduction must occur everywhere, in places which are heavily polluted and also in places which are, by today's standards, pretty clean. Also, I want to add, we talk about particulate matter, but we have new guideline level for NO2, for nitrogen dioxide, which is high in most cities of highly developed countries. So, and also, unfortunately, in countries with lower incomes. But this means that the effort to cut pollution is needed everywhere. And each extent of reduction is translated to improvement of health. So it is not only the task for those exceeding certain limit values or those which are very heavily polluted, it is task for everyone. Thank you.
Thank you very much. Now, I did say it was last question, but we've got a question from Bianca from Globo TV, Brazil, and I think you're a very, very important audience, Bianca. So please unmute yourself and go ahead.
Hi, Margaret. Good to see you again. I was on maternity leave. Good to see you again, finally. Yes, I have two questions. One, just a clarification, because as far as understood, Dr. María Neira, in Spanish, she said that 80% of deaths could be avoided. But then Dr. Michał, he mentioned something about 3 million lives that could be saved. So I got confused. I would like just to clarify this figure. And if you have a message regarding Brazil, because yeah, of course, you know the situation in Brazil, it would be very good if you could also give us an idea. Thanks a lot.
I will start with the second one, and then I will pass it to Michał for the other one. A message for Brazil. Brazil is an incredible country with incredible natural resources and very good health professionals in all sectors and innovation. So my recommendation for Brazil will be to move into this green and healthy, sustainable development. They can do it. I'm sure that they will give us very good initiatives as well, and the people of Brazil is going to make it. You have to create this demand, and I'm sure that it's going to come on this sustainable development, because you have all the resources. We depend so much on you for biodiversity, for you know, making sure that our lungs will be on better health if you protect the Amazon and other places. So yes, definitely Brazil is a critical place. Over to you, Michał, for the other questions about the 80% and the 3 million.
Yes, thank you. Thank you for the question, and sorry for confusion. I referred to the gain in health if the outdoor pollution is improved only. If we take into account household air pollution, I mean coming from combustion of solid fuels, if this is eliminated, then we actually, this 80%, which is good estimate, this 80% will meet less by at least 5 to 6 million deaths per year globally. So sorry for this confusion. 80% is something which should be emphasized.
Thank you so very much. We really now have gone over time, but you've raised many, many important issues. I should let you know that the embargo is now lifted and the materials are online, so you can access any materials for any journalists attending who did not get a chance to get the materials in advance. Now I'll hand it over to all our panelists for any final remarks they'd like to make, starting with Dr. Neira here.
Thank you all for your attention, and I think this is an agenda for all of us, so I will just urge you to have a look at this, disseminate, create awareness, put pressure on new transformation, and make sure that all of these transitions that we need to protect our lives and to make us safer will be met. Thank you, Margaret.
And over to Bon.
Acabou a CPI? Não, isso é CPI, né?
Thank you very much also for all the questions, interventions, and we will be happy to work with everyone because it's really a task for everyone in different capacities, but contributing to the same goal. Thank you.
Now, thank you. And if you have some technical questions, please direct it to WHO. We'll be happy to answer.
Thank you very much. And over to Dr. Kluge in Copenhagen.
Thank you. My sincere appreciation for all your engagement, your interest in these air quality guidelines. I would say 15 years in the making, but the timing could not be more opportune. We know environmental risks, climate change on everyone's agenda, and it will be the focus, as Dr. María Neira was pointing out, of high-level discussions, and we hope agreements at the COP26 in Glasgow beginning late next month. Finally, health is wealth. I think that's very important to keep in mind if we talk about investing, and second, leaving no one behind. As Dorota was mentioning, the vulnerable are already punished twice. Health is wealth, and let's leave no one behind. Thank you so much, and stay healthy.
Thank you very much, all. And indeed, this has been a labour of love. Some of the people working on this are no longer with us on this earth. They gave their life to this work. And if you have more questions, please send them to media inquiries at who.int, and we'll do our best to get all your questions answered. Thank you very much. There is one more intervention. Michał, you would like to say something more?
Well, you already mentioned this, but it is my role as a current co-chair of Guidelines Development Group to remember two members of the team developing the guidelines, Martin Williams, who was the co-chair of Guidelines Development Group, and Kirk Smith. Both put years of their engagement in helping WHO in preparing the guidelines, and they passed away a year ago without getting to this moment where the guidelines are launched. So I want to remember about them.
Thank you very much. And thank you to you and to all the people, and the people who indeed gave their lives to this work. And please do send your questions to us, and we look forward to hearing from you all at our next presser and, of course, in the future.